Is bladder nerve stimulation covered by insurance? When considering bladder nerve stimulation, a common question arises. Is it covered by insurance? Bladder nerve stimulation, particularly sacral nerve stimulation, is often covered by many health insurance plans, but there are specific criteria that must be met. This treatment is typically used for conditions like overactive bladder, urinary retention, urinary incontinence, and fecal incontinence, especially when other treatments have not worked or are not suitable. To start, insurance coverage usually hinges on medical necessity. This means that the patient must show a significant clinical need for the procedure. For example, if someone has symptoms like overactive bladder or urinary retention that have not improved with standard treatments such as medications or behavioral therapies, they may qualify. Insurers often requiring documentation showing the severity of symptoms and a successful trial period with the nerve stimulation device, demonstrating at least a 50% improvement. Most insurance plans also requiring a trial period before permanent implantation of the device. During this phase, the patient's response is closely monitored, often using voiding diaries or other clinical measures. If the trial shows positive results, then the permanent implantation is usually authorized. It is important to note that coverage is generally limited to devices that are approved by the Food and Drug Administration. For instance, the Vocare bladder system is FDA approved for specific patients, such as those with certain spinal cord injuries and intact bladder reflexes. Additionally, some insurance policies set eligibility criteria, including minimum age requirements, often stating that patients must be at least 16 years old. They may also specify particular diagnoses, such as non-obstructive urinary retention or overactive bladder. There are also exclusions to be aware of. Insurance plans may not cover the procedure if the patient has contraindications to nerve stimulation or if their condition does not meet the policy's criteria. Furthermore, some plans may not cover nerve stimulation for conditions that fall outside of approved indications. Regarding the device itself, many insurers will cover the permanent implantation of the nerve stimulation device and may authorize the replacement of power supplies or batteries when necessary. However, coverage for lead revisions may be excluded unless there is a clear medical need. From the perspective of bladder health and bladder cancer, nerve stimulation is recognized as a treatment option for urinary symptoms that can arise from bladder dysfunction, including those related to cancer treatments or neurological issues. However, coverage for this treatment depends on meeting strict clinical guidelines and the specific terms of the insurance policy. For anyone considering bladder nerve stimulation, it is crucial to consult with healthcare providers and the insurance company. This will help confirm coverage details, understand the necessary criteria, and ensure that the treatment plan aligns with approved medical guidelines.